Hi, my name's Dave Kelton, and I'm a veterinary epidemiologist in the Department of Population Medicine at the Ontario Veterinary College. I'm also proud to be the Dairy Farmers of Ontario Research Chair in Dairy Cattle Health. I've been at the University of Guelph for almost 30 years. As an epidemiologist, I do three main things. I teach epidemiology and dairy health management to undergraduate, graduate, and DBM students. I do field-based research on dairy farms across Canada focused on infectious disease control of cattle. And I work with dairy producers and dairy veterinarians across Canada to solve problems related to dairy cattle health and production. When I graduated from OVC in 1984, I thought I'd never darken the halls of academia again. But after spending 3 years in clinical practice, I was starting to develop some questions about my diagnostic and clinical skills. Specifically, I wondered, why was I better at making a good diagnosis or the correct diagnosis on one farm and not necessarily on another? Why did I seem to have some diagnostic tests that performed well for me and others that didn't? And thirdly, why were there some clinicians that seemed to use the same test but came up with better decisions or diagnoses, while others weren't necessarily as proficient? My search for the answers brought me back to Guelph and the discipline of epidemiology. I completed a master's project evaluating the sensitivity, specificity, and predictive value of rectal palpation as a test for deciding when cows were in estrus and ready to be bred. I learned that our diagnostic skills, or tests, perform differently in the hands of different veterinarians, and that the veterinarians who are better diagnosticians use multiple tests to make diagnoses. In some cases, they interpret these tests in parallel, and in other cases, in series. From there, I went on to do a PhD in epidemiology and began a working relationship with CanWest DHI. CanWest DHI is a milk recording organization that collects and tests milk samples from individual cows on over 75% of the dairy farms in Ontario every month. I've spent a significant time of my research career working with CanWest DHI over the last 25 years to help them evaluate and validate many of the milk-based tests that they offer to dairy producers every day. Some of these tests are for components like somatic cell counts and ketone bodies, and others are tests for diseases, Johne's disease, bovine leukosis, and mastitis, to name a few. Based on this work that we've done together, some tests have been adopted and are offered to dairy producers every day, while others have been discarded based on their poor performance. I'm proud to know that this application of applied epidemiology is helping dairy farmers and dairy veterinarians make better management and disease control decisions every day. Thanks for watching, and if you have some interest in applied research with dairy cows and dairy herds, drop me an email. Good luck and enjoy the rest of the course.